Bye.
Welcome to Knock Knock Eye with me, your host, Dr. Glockenflecken. This is your one-stop shop for all things eyeball related. I've got a few topics today. I'm going to talk about liminal spaces. I saw the Backrooms, the movie, and I really enjoyed it. I was familiar with the YouTube lore behind it, going into it, and thought it was a great movie. And I want to, so a little bit of liminal spaces, and then I want to talk about a tale of two health systems that gets into corporate practice of medicine, my favorite topic, and then also have a couple Spotify comments to get to. So first, the Backrooms. So it made me think, like, what are the most liminal spaces in a hospital setting? So in case you're not familiar with the concept of the Backrooms, and it is this guy Kane Parsons that started making these YouTube videos based on a screenshot that showed this like kind of yellow hallway, kind of this, it basically a liminal space. It like brings you into this world that's like nostalgia, uh, empty, unsettling, a weird, architecture to the place. Think like hotel hallways at night or abandoned shopping malls or like community pools, but they're always empty. There's no one around. Just kind of really creepy, unsettling places. That's like the basis of the Backrooms. Is it puts you into one of these places. And so it made me think, watching the movie, like, what are the hospital liminal spaces? What are the creepy places in the hospital? And immediately I thought, okay, the basement. There's no windows. The lab is down there. It's very sparsely populated. You're not going to find a lot of people down there. And just long hallways, random doors. You don't know where they're heading to. Most of them are locked. There's like, a steady hum of the generators or whatever it is, the furnace, the HVAC units. I don't know what's making the noises, but you just get that going, and who knows where it's coming from. And I don't know what else is in the basement. You guys tell me. Pathology lab. That's where the morgue is. I don't know. Uh, uh, the the operating room, in a big hospital, the operating room, like in the middle of the night, you're on call. You have to go do like an emergent case in ophthalmology. It's like an open globe injury. Sometimes you go up there at like 2 or 3 o'clock in the morning. There's really like there's very few people around. And it just has kind of a spooky vibe to it. It's like, oh, this should be full of people, but it's not. And also lack of windows. I think just not having windows and being able to see the outside is just a very disorienting process. There's a reason that it causes like delirium in patients whenever they're like stuck in a windowless room. You don't know what time it is. There's people coming into your hospital room at all hours of the night, and you're not sleeping. It does sound like torture, doesn't it? So anyway, go check it out. Backrooms. I really enjoyed it. Okay, so I want to get to a couple of Spotify comments here. This is going to be your ophthalmology for the day. Jack asked, I want to know what ophthalmology boards are like. What is the recertification process? Like, do you study? How much? So for those of you who are not in medicine, whenever you graduate residency, you have to take a board exam. Like, this is a specialty board exam, to prove that you know enough about your specialty that you just studied for 3 to 7 to 15 years if you're a neurosurgeon, in order to be able to see patients independently. So you'll hear people talk about they are board certified ophthalmologist. I am a board certified ophthalmologist or board certified nephrologist. When you first graduate residency, you're looking for a job, you are board eligible. That means you've done your training, so you can take boards to become a certified ophthalmologist. And most practices will only take certified doctors, right? That's because you want people that actually learned enough to be able to to know the basic amount of information you need to know. And it's always a bit of a stressful time. That's like the last big test that you take. Well, what people may not realize is that most specialties, I think probably all specialties, require board recertification. Now, I don't know if this actually happens in like other other fields, like plumbing, an electrician. If you work as a mechanical engineer, do you have a recertification process for whatever certification you get? Is there even a certification process? I know there is for like, some of the trades like welding, like you got to be certified to be a welder. Do you have to take regular tests every so often? Or is this a very specific medical field thing? Like not just doctors too, like nurses, physical therapists, occupational therapists, pharmacists, all the way. Um, is there this recertification process? Because this draws a lot of ire in the medical community. Physicians generally don't like this. And I am on the side of I think it's basically a money grab is what these recertification exams amount to. Um, because what do you mean? Like I have to prove that I still have enough knowledge about ophthalmology to see patients. And in the past, like historically, most of these were like every 10 years, you have to go in and take a test. And if you fail the test, I guess you have to take it again, but it's another 500, 800,000 bucks to take this test. That's where the money grab part of it comes into it. Cause not only do you you already know like everything you've been practicing for 10 years. What do you mean? I'm not going to unless I have some kind of medical issue, I'm not going to lose all that information. And so you have to go and prove, oh, I can still do this job. Like it just doesn't quite sit well with me. The fact that it costs so much money to do it. And so some of these and so every specialty they have like a board, a company that's just called the Board of Internal Medicine, the Board of Ophthalmology. They have different names for them, but it's an organization that this is just what they do. They put on board exams for new graduates, and then they run this recertification process, just raking in all this money. And some people might say, well, I mean, it costs money to do the board exam process in the first place. It's like, okay, well, that's why you charge the new graduates to take the board exam. I get that. But what's with the recertification? Like, why does it? And on top of that, your dues. You have dues. Like, it's however much money per year that you have to put forward. Now, I will say ophthalmology, although I don't agree that we have to take tests and things, ophthalmology has made it easy. Because when I was in med school, I remember hearing my mentor ophthalmologist talking about this. She had to go and physically go somewhere like Prometric and take a test and pass that test. Now in ophthalmology, what we have is you have to do what are called quarterly questions. You can do it from the comfort of your own home or your office. And every quarter they come out with like 20 questions. And it's like, obviously it's like open book, it's timed, but like you can look stuff up if you need to. And you probably actually don't have much time to do that, but you could, I guess. But it's generally pretty basic, but you do it on your own time. It's still a recertification process. We could go back and forth on whether or not that's even necessary. I do think maybe if you're planning on working past retirement age, you probably should take a test. Like if you're I'm planning on working past the age of 65, well then why not at 60 or 65, you do have to take a test to make sure cognitively you're still there to be able to operate and make clinical judgments. Because things happen, dementia happens, other neurologic conditions happen, and more frequently as you get older, potentially. And so, I think that's fair. But otherwise, we're all so busy. I'm so far behind on my Don't Tell the Board of Ophthalmology. I'm so far behind on my quarterly questions, you guys. It's not even funny. So I'll be spending the better part of a week just doing that to catch up, probably sometime this year. So anyway, I think really what they should make us do is just the show that we've done CME. Why can't we just do that? We have to do that as well. I got to like say, I got to do like a certain number of hours of medical education every year and this board certification process. It's just, it gets to be a lot and surely contributing to the overall feeling of burnout in the world of medicine. So let's rein it in with this board recertification process. It's not like a huge deal. It's not top priority for like reform in the medical field, but I think we could do better with it. But as far as the test itself, I had to go and do the first year out of residency. I went and took a prometric exam, my board exam, which I passed. And then once you pass the written test, then you go and do an in-person exam. And this is pretty nerve-wracking because you go, well, it's a weird situation because you go to a hotel. Typically, it's in San Francisco. At least mine was. So you go to a big hotel in San Francisco. Hundreds of ophthalmology graduates show up, and you are assigned a specific series of hotel rooms. You go into these, and these are timed tests. You go into this hotel room, and there are two examiners there. And it's literally the hotel room that the examiners are staying in while they're there doing these exams. They got like luggage in the corner. They got the toothbrush in the bathroom. It is like they stayed there that night. Now, fortunately, I think they're told to make the bed, but it's still like a little bit like unnerving to like, okay, you're a stranger. I'm in your hotel room. I've never met you before, and you're going to be asking me ophthalmology questions. Just a very strange situation all the way around. But you only spend like maybe 10 minutes in there with that because they're peppering you with questions and questions and questions. And eventually, like you get to the point where either you've answered all the questions, or what's more typical is you get to a question that's so hard you just don't know it. And that's what makes it difficult to know like how you did on your oral board exam, which is what this is. Because it's like, oh, I didn't know some of these. They showed me a picture of some awful looking cornea. I didn't know what the hell that was. I had several of those. Cornea is hard. And so you leave not being totally sure like how you did. And it's just like a big sigh of relief. Whenever a few months later, when you get your result and you are board certified, because that's like the last real test you have to take. We have these recertification quarterly question things. That's not like a real test. Last test I ever had to take, and that was now 9 years ago. So I still remember very much a lot about it, mainly because it was in San Francisco and there was a massive strike of hotel workers occurring outside the hotel. So there were like no hotel workers in there, just like a bare bones crew of like managers. And it was kind of a mess. And it was loud. There was chanting, and fortunately, I was able to pass my test. So anyway, that's the ophthalmology board examination, and it's like $2,000. It's like, and plus you got to like travel. You got to go there. So it's an expensive process between that, your USMLE exams, applying for residency programs, applying for fellowship programs if you're doing a fellowship. Like it all adds up to like probably close to $20,000 just to try to make sure you get a job. It's not even counting like living costs and tuition. And it just all because you're not making any money at that point. I mean, you did for residency, I guess, for board examination, but it all adds up, and just not until you really go through it or you have a family member who's gone through it do you really start to understand like how behind the eight ball we are when we start our first job, our first high paying job as a practicing physician when we're 31 at best. A lot of people are 35, 36, and you've had your peers have been working since they were 22. So you got 10 plus years where you really were not saving money. You're just surviving. You're not contributing to retirement, and you got to catch up. You got to catch up. It's a huge. You're behind. And so all the talk about like, oh, physicians, they make so much money. Like we need to rein that in. Physicians don't need to be making that much. Maybe you're right, but you can't adjust that. You can't like change reimbursement and have this mindset where a physician should make less money unless you change the other stuff, unless you change like the amount of tuition we pay, unless you just, take out all these extra fees and things, because we're getting a late start in life. And I'm not saying this to like make you feel bad for us. It's just, it's an investment in your youth. It's a big part of your life. All of your 20s, basically, studying, working really hard. And everybody does that, but like, also not making money doing those things for a hope that you're going to live a very comfortable life in the future. And that can be done by making less money as a physician, but not unless you like take away some of the barriers and the $400,000 into it in debt that we go into before we ever start really making a paycheck. So anyway, I kind of got off on a tangent there. Let's take a break. We'll come back and I'm going to talk about 2 different healthcare systems. Hey, Kristen, remember how you love eyelid mites now?
Mm-hmm. Sure.
Well, there's a lot of confusion out there. I want to clear something up.
Okay.
All right. People think they can get eyelid mites from dogs and cats.
Can they?
No. These particular Demodex mites are specific to humans.
Okay.
So spread from dogs and cats is not expected. That's a myth.
Can't get them from cuddling our poodle.
No. Demodex mites that cause blepharitis live on humans. Most adults already have them. They just usually don't cause problems. It's when they overgrow that they can lead to itchy, red, irritated eyelids. Those little collarettes.
Mm-hmm. The crusties at the base of the eyelashes. Right. And the good news is there's a prescription eye drop available for Demodex blepharitis.
That is great news. To learn more about eyelid health and Demodex blepharitis, visit miteslovelids.com. Again, that's miteslovelids.com to learn more. This ad is brought to you by Tarsus Pharmaceuticals. All right, here we go. A tale of 2 health systems. So this is corporate practice of medicine. All right, first is one you know all about if you've been listening to this podcast for the last few months, PeaceHealth. I'm not going to go into all the details because we've talked a lot about PeaceHealth. But just big picture, 10,000-foot view, what happened with PeaceHealth? The emergency doctors were getting replaced. So they fought back. And the way they fought back was both hitting social media, talking to me, getting my help, talking to the community, talking to the press, support from their fellow physicians and the nursing union. They had a survey that basically said everybody, like 90, almost 100% of all the medical staff, doctors and nurses, saying we have no confidence in the CEO because of this decision to get rid of our local emergency doctors for this corporation based out of Atlanta, Apollo MD. Not only that, but they were able to take it to court and sue the hospital and sue Apollo MD for a violation of this corporate practice of medicine law that we have in Oregon. And again, this all started because PeaceHealth decided, you know what? We want to go with this staffing corporation because we think that we can, save a little money. Actually, we don't honestly know what PeaceHealth was thinking. We still never got a good explanation for why. All right, so that's health system number 1. All right. Contrast that to something I've been talking about recently on social media, which is Valley Health in Virginia. This is based out of in Winchester, Virginia, which is I've learned not to call it Northern Virginia because that's known as Nova. I learned so many things talking about geography because people get so up in arms. Like when I accidentally called Eugene Southern Oregon, even though they're not, and that was totally on me. That was a massive mistake. But people really are very specific about where their geographic designation. And I learned that even though Winchester, you look at a map, Winchester, Virginia, it is in the northern part of Virginia. I learned that saying Northern Virginia actually denotes like the outskirts of Washington, D.C., which is not a rural area like the Shenandoah. So really, Winchester Valley Health, it's in the Shenandoah Valley. Right? That's what I should have said in one of my videos. But instead, I said Northern Virginia, and I had people like, this is not Northern Virginia. This is not Nova. What are you talking about? No, don't call us Nova. I didn't. I said Northern Virginia. I didn't even know Nova was a thing. But anyway, so the Shenandoah Valley, that's where Valley Health is. And over the past few weeks, I'd received like multiple comments about this group of emergency physicians that were like, the same thing's happening to the doctors over at Valley Health. You should look into this. You should look at. It's like all these different, just random comments from people. It's like, okay, well, there's clearly something here because people can't stop telling me about this. I was getting messages, emails, and so I looked into it. I started talking to some people, and so it turns out here's the story. So Valley Health decided rather suddenly in April that they were basically canceling the contract for EMBER, which is Emergency Medicine of Blue Ridge. So it's an independent Democratic group of emergency physicians, not unlike Eugene emergency physicians, right? An independent group. They're their own boss. They're doing things their own way. They've been a part of Valley Health, working in their emergency departments. And Valley Health's a big system. There's multiple different hospitals. Their main one is right there in Winchester, Virginia. So it's a fairly rural area, all right? If not in Winchester itself, just the surrounding areas. They've been working there for 20 plus years, all right? Long history, doing great. By all accounts, Valley Health has a great track record, all right, for decades. It's been like a good health system in the region. And in April, Valley Health, and under the guidance of its CEO, Mark Nance, decided, oh, you know what? We are not going to do this. We're going to take your contract and we're going to give it to SCP Health, which is a corporation that is backed by a private equity firm in Canada, Onex Corporation. All right, so SCP Health operates very similar to Apollo MD. Like they all have the same blueprint. All right, they have they have a headquarters somewhere in the country, and then what they do is they start these dummy corporations, these dummy companies in the states they're wanting to go to. They handpick a doctor as the mouthpiece of this organization, and then they say, "Oh, they're going to be leading the charge there," but it's really influenced and owned by the company that backs them. In this case, it is 100% private equity owned. Like Apollo MD, they tried to obfuscate the fact that they had connections to private equity. SCP Health is like all about it. They're like, "Oh yeah, no, we're totally private equity." They're private equity through and through. So anyway, these EMBER, Emergency Medicine of Blue Ridge, were told they weren't getting this contract. It was going to SCP Health, which they've just been buying up emergency physician groups, getting these contracts from hospitals, but also hospitalists. So this affects the hospitalists and the pediatric hospitalists in Valley Health. All right. So I just talked about emergency medicine. I'm sorry. I should have also mentioned that this is screwing over many more people than just the emergency physicians. So anyway, and I'm reading. This is all the information about this is coming from local news sources, by the way. So I'm just gathering everything I can find, and we don't have, similar to Eugene, don't have a great reason. The only reason we've been given for why Mark Nance has suddenly made this decision is because the one big beautiful bill is resulting in massive cuts to Medicaid, which is true. And in order to stay afloat, Valley Health has to cut $80 million in costs per year due to lost reimbursement. And so, of course, what else would you do when you're in that situation? Then cut the people who actually see patients. How does this make any sense? This is what I don't understand, because by all accounts, Valley Health is flush with cash. All right, they have $1 billion in holdings. They have reserves, cash reserves over $700 million. They have and they recorded a net profit in 2024, by the way, of $100 million. So their investment portfolio is over $700 million. That's what it is. So in short, they're doing just fine, folks. So I think we're going to be seeing a lot more of this. We're going to be seeing a lot more of health systems using Medicaid cuts from the One Big Beautiful Bill, which is the gift that keeps on giving. They're going to be using those cuts as an excuse to make all these terrible decisions for communities, for patients, and particularly for doctors. Because I think what people like Mark Nance do not like, they don't like independent physicians. Because they're not malleable. They can't be subjected to the metric standards that some CEO at a health system desires, because they're independent. They're going to practice medicine the way they want to practice, and that just sticks in the craw of people like Mark Nance, who feel the need to control everything. And there's a pattern of this with CEO Mark Nance and Valley Health. There's a pattern, because this year they also kicked out Front Royal Family Practice. They had an agreement with this family medicine group, this independent group. They basically, what Valley Health was leasing this practice, which allowed Valley Health to collect some of the revenue from the practice. The family practice got a stipend, and also were teaching in the residency program. And Valley Health literally said, you can join us, you can dissolve your practice and join us, or you can leave, and you cannot be affiliated with Valley Health whatsoever. How do you do that? That is not about budget cuts. That is purely greed, wanting to own everything in the Shenandoah Valley. And why? Because then you have more control. You can tell physicians to see a certain number of patients in a certain way and refer for certain things. You can keep tabs on them. You can put pressure on them in different ways because you own them, because they're your employees now. So I bring this up because, as you can tell, there's a starkly different reaction to all of these things that Valley Health is doing versus what we saw in Eugene with PeaceHealth. You don't hear anything from the doctors and nurses at Valley Health. There's no surveys being done showing lack of confidence in their CEO. There's no lawsuits because Virginia does not have protections against the corporate practice of medicine. There is no corporate practice of medicine law. Not even close. Not even the flimsy one that some states have. At least they have something on the books. Virginia has nothing. There's no protection against this. No protection against private equity coming in and just owning whatever they want to own. SCP Health, they can flaunt their private equity affiliation all they want. Nothing's going to happen. No protection against someone like Mark Nance, who's like, God, sounds really honestly the worst of the worst in terms of CEOs. The things I've heard about Mark Nance, not great. Not great. But he's got a lot more power. Also, there's no unionization in Virginia. The nurses, one of the things that really helped those Eugene emergency physicians is the Oregon Nurses Association has a very strong union. And they threw their weight behind those doctors, which I'll be forever grateful for those nurses. All right. I ride for the Oregon nurses. They need me for something, I'm there. Virginia doesn't have that. They don't have a nurses union. They don't have a physician union for sure. And so you don't have this organizational leadership that feels comfortable to speak out. And when you have a situation where there's such a big power imbalance, you get yourself into this situation where you can't speak out. It would not shock me, and I'm sure that like this exists. I'm sure. I can't be positive because I haven't been told this, but I mean, it doesn't take a long leap to just assume that there's this air of intimidation within the Valley Health system, because so many of these bad things are happening in there right now. So many of the doctors are being taken advantage of, and probably all the other healthcare workers as well, that you would expect to hear more out of those physicians. But I'm sure they've been intimidated. I'm sure they've been asked to sign non-disparagement agreements, which should be illegal. Insurance companies do it. Their employees. I'm sure Valley Health is doing it too. I mean, again, I don't know for sure, but the lack of information being put out there. And so the other thing I want to say is thank goodness for local news, because there have been a few stories out there which has allowed me to get the information that I have and that I've put into my videos talking about this situation. And the more with my platform, the more I talk about it, the more I get sent messages from people about what it's like being in the Shenandoah Valley right now, but also about other things happening in other health systems around the country. I can't keep up. I don't know what to do. I could just make this type of content continuously like this. I could just devote all of my social media platform to just talking about doctor groups and hospital systems that are being screwed over by administrators. Maybe I need like a blog. I don't know. I don't know what to do. Honestly, I'm trying to keep up, and I want to. These are really important subjects, and I've already seen a lot of comments about like what's the point of making this type of content? What's the point of even talking about this? Nothing's going to change. That learned helplessness that we have so much of in healthcare, and the reason is because I am uniquely positioned to actually talk about this. Right? I am happy to give a voice to people who feel intimidated against speaking out because they don't want to lose their jobs, nor should they. They should not. I mean, we can't ask people to do that. People that do speak out are extremely brave, but that doesn't mean it's bad on other people for not speaking out. But hey, I'm over in Oregon. I'm in my own practice. As long as everything I'm saying is truthful, which it has been, I'm not going to get in trouble. I'm happy to raise the alarm, tell everybody what's going on and the kind of shenanigans that Valley Health and Mark Nance are pulling. And I'm going to keep doing it too. As long as I keep hearing about things, as long as things keep showing up in the local newspaper. So shout out to Northern Virginia Daily. I think it's called NV Daily. That's where I've seen most of the articles. You know, that kind of stuff is I need that. I need to know all those things so I can just blast it out to this audience of healthcare professionals. And hopefully some of this might put some pressure, because sometimes that's all you can do, especially in a state like Virginia that doesn't have legal protection, that doesn't have unions. Then at least we can put PR pressure. And that's real pressure, you guys. It's up. I mean, the communities see that. I've seen on Reddit, like these videos, they get posted to the local Reddit boards for like Winchester. And that's really important because it's not just the healthcare professionals that need to know this. I'm so glad that these videos, they get out to the general public too. The people in the community, they need to know why their healthcare might suffer. They need to know why this decision by Valley Health will result in a 13% increase in mortality in their emergency department based on the available evidence that we have for private equity takeovers. 13% increase in mortality. That is what Mark Nance and Valley Health are choosing. It's not about budget cuts. Find the cuts elsewhere. Find the cuts elsewhere. All right? Valley Health is building a new rehab center. They're building a new hospital buildings. They're constantly building bigger and bigger. Where's that money coming from? Seems to me you should invest some of that in your physicians. But no, they have to own everything because they have to manage the doctors and have them practice medicine, not the way the doctors think it should be practiced, but the way that will maximize profits for the healthcare system. Fed up. So I'm going to keep making my videos. People, if you see things like this happen, I do my due diligence when I hear about these stories. All right. Because the last thing I'm going to do is put myself at, I don't want to get sued by anybody. So everything I say is truthful. I would never lie about this stuff because these are real people. These are real careers that are in the balance. And so I'm careful about being truthful. And obviously I have a take. I have a bias. I am always going to be in favor of supporting the healthcare professionals, the people doing the work of medicine. All right. But the facts are what they are. It's these administrators, these hospitals are taking advantage of the people who see patients. And if we can't fight them legally, which we can in some states, then we can at least fight them in the court of public opinion. And the public can put pressure on them. You can tell them what you think. Tell them what you think. And maybe this will also put pressure on the legislators to actually come up with some legal protections. Like that is another goal of mine. Like I'm hopefully going to make another video. I'm going to try to do this where I call out the representatives of Virginia. Hey, look at what we have in Oregon. Let's make a bill. Let's put it together. Let's get something going. Let's protect these doctors and nurses who are out there taking care of your communities. Got to support them. That's it for Knock Knock Eye. Not so much of an upper episode, but hey, these are important things. So I'll give you more information as I get it. But thank you all for listening. I'm your host, Will Flannery, also known as Dr. Glaucom Flecken. Executive producers are Aaron Courtney, Rob Gilman, and Shanti Brooke. Editor and engineers Jason Pertez. Our music is by Omer Benzvi. We also have a YouTube. These videos go up. These episodes go up on our YouTube channel at Glaucom Fleckens. By the way, that's our podcast YouTube channel. Go check it out. Leave a comment there, or anywhere you get your podcasts. We also have a Patreon. You can check that out. I'm recording a whiteboard presentation a little bit later to put up on there where I explain a few things about medicine to all the wonderful people on Patreon. So there's fun things happening on Patreon. Check that out. Thank you all for listening. Knock Knock Eye is a human content production. We'll see you next time.
Knock knock. Goodbye.
Thanks for watching the episode. You can find more on that playlist over there. If you prefer to listen, or you just had your eyes dilated, you can binge full episodes wherever you get your podcasts. Or join the party over on Patreon, where you get early access episodes, hang out with us, get lots of exclusive bonus content. Hope you subscribe, leave a comment below. Let us know what you think.